Hello, my name is Donna Giovingo. I'm a clinical educator here at St. Tammany Health Systems in the Women and Children's Services Division. I'm going to be guiding you through the prepared childbirth PowerPoint. We'll start with the stages of pregnancy. The trimesters of pregnancy, there are 3 trimesters, which I'm sure by this time you're aware. In the first trimester is weeks 1 through 12. The second trimester is weeks 13 through 28. Third trimester is from week 29 to week 40. First trimester changes. There's a lot of fetal development that goes on in the first trimester. Those first 12 weeks are very, very important, which is why your doctor tells you to take your prenatal vitamins, or at least vitamins that don't upset your stomach, because sometimes the prenatal vitamins do. So it's okay if you just take regular vitamins. It's also important to have a healthy lifestyle right now. So that includes no smoking, no alcohol, or anything else that could harm your baby. By the end of the first trimester, all the baby's major body organs are formed, and the weight is just over an ounce. In the second trimester, your body's adapting to meet the needs of your growing baby. Your uterus is expanding. So at this point, during the first trimester, I'm sure you experienced a lot of nausea and a lot of needing to go to the restroom a lot, because your body's getting used to having extra volume in its body because of the growing baby. So in the second trimester, there's increased pressure on your bladder, on your stomach, and other organs, because that uterus is growing and expanding, and it's kind of pushing everything up and out of the way so it has more room. You may notice some skin color changes on your forehead, your nose, and on your cheeks, and this is perfectly normal. There's also mood swings because of hormones, pregnancy hormones. In the third trimester, your body's getting ready for labor. Increased weight gain from fluids and extra blood, and of course fat. Now, we don't like having fat on our body, but it's very important when you're pregnant to gain weight, because this is what's going to help keep your baby healthy. Your breasts will begin to grow, they will become more tender, and you might have a slight yellow discharge from the nipples. This too is normal. This is just your body and your breasts getting ready to start making milk for when the baby does arrive. You also may notice an increase in vaginal discharge. There should not be any strange color or an odor associated with this vaginal discharge. If you do notice any type of like color change, like it's more yellowish or greenish, if there's anything associated with it, such as an odor or an itching sensation, do go see your doctor, because it might be a sign of infection. Let's see. Also, skin color changes on forehead, cheeks, and nose, we mentioned. Fetal development in the third trimester. In month 7, your baby's measuring about 14 inches long. And if born prematurely at this time, your baby will most likely survive with special care. Special care meaning time in the NICU. If you do deliver your baby during this time, a neonatologist and also the nurse practitioner, the neonatal nurse practitioner from the NICU will speak with you and keep you informed of everything that's going on with your baby's care. In month 8, the baby is gaining body fat, which he or she is going to need when he's born. You're going to feel more stronger kicks when the baby's moving around, because this baby's doing a whole lot of growing at this point, and this is when they start packing on some weight. Month 9, the baby weighs nearly 7 pounds and measuring about 18 to 20 inches long. So month 9 is when you should be expecting to have a birthday. Now, here are some comfort tips for the third trimester. Most people experience at least 1 or 2 of these that are listed. Some people, some unfortunate, will experience all 4, and I have to say that I was one of those. So let's talk about some tips to help reduce these. Number 1 is heartburn. So to help reduce heartburn, you should eat small, light meals throughout the day rather than 3 large ones. At this point in your pregnancy, it's a little bit harder for your stomach to empty everything that you eat into the small intestines at a rate that it normally does when you're not pregnant. because the uterus has grown, it's gotten so big, your stomach is kind of squished up a little bit, a little further up into your chest. So therefore, if you eat a larger meal, you're more likely to experience heartburn because of how long it takes your stomach to empty. So it may help to sleep with your upper body raised about 6 inches. You might hear some ladies say that they're more comfortable sleeping in positions such as with a recliner if you don't have extra pillows. And then make sure you don't lie down until 2 hours after you eat. That just gives your stomach some time to start emptying the food. Constipation. It is a common problem during pregnancy. A lot of times it has to do with the increased iron that you're taking. So to help with constipation, increase your fiber intake and also increase your water intake. I know your doctor or nurses have probably preached to you about how much water you should take in. So drinking about 8 to 10 glasses of water helps keep you hydrated and also helps to ward off constipation. And of course, exercise. Now don't go crazy with the exercise, but just a little daily exercise will help with constipation. Your breasts. Especially if you're planning on breastfeeding, avoid harsh soaps or alcohol or anything like that on your breasts because it can cause dryness. So this is one way to kind of ward off cracked nipples when you're breastfeeding later on. So just remember, when you take a shower, don't put the soap directly onto the nipple area because that is going to dry it out. So having soap run off of your breast is fine, but really just rinse with water. That's the best thing you can do. Wearing nursing bras for support is also very important. Sleep. Try to take a warm shower before bed. That might help relax you. You can sleep on a firm mattress. That would also help with like backaches. Laying on your side with one leg crossed over the other, and even using pillows between your legs or to support your belly. So it's important to sleep on your side and not to sleep on your back. But don't panic if you wake up on your back during the night. It's perfectly fine, but it is best to try to sleep on your side. Other changes in pregnancy you may have noticed. Increased urination, which mostly happens in the first trimester. However, it does happen in the third trimester because of the weight of the uterus. Excessive salivation. That's also normal. Shortness of breath. I do want to mention shortness of breath especially because it should only be shortness of breath with exertion. If you're having to walk a certain distance or if you're doing some exercises, some shortness of breath is okay and perfectly normal. Only because the uterus size and then you having to expand your lungs more because of the baby. However, if you're having shortness of breath where it's distress, if you're having like distressful breathing or having very much difficulty catching your breath, please talk to your doctor. If it's an emergency, please go to the emergency room and be evaluated. Insomnia. We also talked about sleep problems, so we've already talked about insomnia. Varicose veins and hemorrhoids, also very common, mostly to do with the increased volume in your body because of the pregnancy and also because of pressure from the weight of the baby. So hemorrhoids, you can treat those with the regular hemorrhoid pads, but of course discuss all this with your physician. Abdominal pains. So you may have odd pains here and there, some shooting little pains, which a lot of times you'll feel like shooting pains in your vagina, and most of that is because of the baby moving and the baby kicking. However, you also might experience some cramping and you might have some contractions here and there. So if you're having abdominal pains that feel like cramping and contractions and you're not term, so you're not 37 weeks or further, you need to speak with your physician because that would be considered preterm labor. Pica. Now pica is a word not everybody knows what it is, but what pica is having a craving for things that aren't food. Now a lot of times, a lot of women tend to eat ice. I'm definitely an ice eater, and I found out that I was anemic. So there is a link between anemia and eating ice. So if you notice that you're eating a lot of ice, let your doctor know. But pica really has to do with things that could possibly be harmful. So if you're finding where you're wanting to eat things like hair or, yarn or just plain flour or things like that that aren't food, please discuss that with your physician. Dizzy spells, especially in the third trimester, dizzy spells can be common. However, it should only happen like if you're lying down or sitting down for a long period and then you get up suddenly. You might notice that kind of rush with your blood pressure, where your blood pressure drops and you start to feel a little dizzy, but it should only last for a few seconds. If this is happening often, please talk to your doctor. Arthritis. Now that's on here. I'm not really sure of pregnancy causing arthritis. I'm not really sure where that came from. However, you can have some joint discomfort. A lot of that has to do with the next one that has swelling. So you can get some swelling in your joints and have some discomfort, but pregnancy does not cause arthritis. But let's also talk a little more about swelling. Swelling in the feet and the ankles, especially if you've been up and about a lot during the day, that's normal. That will go away if you lie down, prop up your ankles and your legs higher than your heart. So if you stay like that for a little bit, that'll help reduce the swelling. Also, increasing your water intake will help with that too. Now, if you start to notice that you're having an increase in swelling that kind of goes up to your knees, if you notice swelling in your hands, in your face, make sure you tell your doctor, because that could be a sign of preeclampsia. Stretch marks. Most everybody gets stretch marks. Not everybody has them as badly as others. But most people do use like cocoa butter or lotions with cocoa butter to help relieve those stretch marks. Nosebleeds. Very few people will experience nosebleeds, but it does happen. And it's just because of the increased volume and the increased vasculature that's in your nose. And if you notice while you are pregnant, you're very, very sensitive to smells. And that's because of that increased vasculature that's in your nose. So having a nosebleed can be normal, but please tell your doctor about that too, especially if it's happening more frequently. Round ligament pains. Now the round ligament is found kind of in your groin area. The further you are in your pregnancy, you'll tend to have that round ligament pain. It's usually a sharp pain. If you move or twist funny or step a certain way, or it could be anytime, standing up, just walking, you'll get that sharp pain right down into your groin, and that is your round ligament. Because during pregnancy, your ligaments are more relaxed, and that's because of the certain hormones. Now, if you're not sure what you're feeling, please talk to your doctor, or even come up to the unit and be checked out. Headaches. Headaches can be common because of the hormones, but if you're noticing you're having more and more headaches and they're not controlled by Tylenol, because Tylenol is okay to take for headache, if it's not being controlled by Tylenol, please speak to your physician. Contractions, we kind of talked about contractions. Depression and anxiety. Now, everybody does have their ups and downs because of the hormones. You can experience a little depression or sadness, have some anxiety because a new baby is coming and you'll be going to the hospital and having to go through labor and delivery. Those are all perfectly normal emotions. But if you feel like it's a little bit out of control and a little bit out of ordinary, please talk to your doctor about that too. And that's something else I want to put on the spouses or the significant others. If you do notice any behaviors that are way out of the ordinary, please, speak up, because it is very important. And sexuality. Of course, sexuality is important too. There are certain instances where your doctor will tell you no sexual activity after a certain point, but that just depends on what's going on with your particular pregnancy. exercises in pregnancy. Back pain is something that's pretty common during pregnancy. So you need to learn how to practice good posture, aligning your ears, shoulders, and hips. So that's just standing up straight, keeping your pelvis level, and then being up on your feet too long. Like I said, that does kind of increase swelling in your ankles and your feet, and it can also cause some back pain. So try to sit down when you have a chance, and then sleep on your side with your knees slightly bent, with a pillow in between would be best. Moving safely, rising from your side, push up with your arms, try not to use abdominal muscles. Don't bend at the waist, which if you've tried to bend at the waist and you're in your third trimester, it's very difficult. So telling you not to bend at your waist, okay. Lift with your legs and not with your back. That is just good, like motor movements. So we always should try to lift anything that's heavy with our legs and not strain our back, because it does put a lot of pressure on your back. But at this point during your pregnancy, you do not want to be lifting anything that weighs more than, say, 10 pounds. And then exercises for your back. You can do lower back stretches. Anything that you don't have to lay on your stomach. Laying on your side or just standing up and doing side bends and stretches will help to ease some back pain. Lower back stretches. You can lie on your side, bend your top leg, hold on to your top leg below the knee, and gently pull up and out towards your shoulder. Count to 30. Slowly bring your leg back down, and you can repeat this stretch 5 times. So you can switch sides and repeat 5 times with your other leg. So exercising can help you relax, also help you with constipation, and help you get ready for labor and delivery. But of course, talk to your healthcare provider or your doctor about different activities that you can do. So staying active, walking, it's all important. However, if it's exercises you're used to doing, that's fine. You can typically continue to do that unless it's very strenuous. So speak to your doctor about what type of exercise or exercise activity that you normally do. I don't suggest you decide, okay, well, I'm pregnant now, I need to get in shape, I'm going to go start running 2 miles a day. I wouldn't suggest that. Walking is always good. Kegel exercises. Kegel exercises help to strengthen the pelvic floor. So Kegel exercises is just like trying to hold in your urine. When you get that feeling that you really need to pee and you tense everything up down there, that is your Kegel exercises. So you can sit in a chair or lay in the bed or be just about anywhere and just tense up those muscles, hold it for about 10 seconds, let it go. Then tense it up, hold it for 10 seconds, and let it go. And you can do plenty of those during the day, any time of day. So maintain your routine so you can stay active. Exercise less intensely if you feel tired. Of course, like we mentioned, the shortness of breath. If you start to feel short of breath, please rest, catch your breath, and then you can continue your exercise if you feel up to it. So base your workouts on how you feel, not necessarily your heart rate. Okay, we don't want your heart rate to go too high. So heart rates aren't a good way to measure effort during pregnancy. And then, as I said, we don't want you to do exercises laying on your back after 16 weeks of pregnancy, because the weight of the baby lays onto your big vessels that are in your abdomen. So laying on your back for long periods of time are not good for you or for the baby. The right exercises for you. So your overall conditioning is best. So walking, swimming, riding a stationary bike. We don't want you to do anything that's going to cause you to fall or to get dizzy. So just make sure that these are safe exercises for you. Always warm up, have a cool down, and make sure that you have plenty of water with you so you can stay hydrated. And I don't know if anyone's ever told you, but if you get to the point where you're thirsty, you're already past dehydration. So you should never feel thirsty. Always have some water with you at all times. If you're already exercising, adapt your routine to your pregnancy. Prenatal exercise classes, such as water aerobics, or even some exercise videos are very good to help you with staying active. If you're not exercising, like I said, don't go start trying to run 2 miles a day if you haven't done it before, but find the best way to start. And walking is a good exercise to start with. And then avoid risky activities such as horseback riding, scuba diving, skiing, skating, contact sports, anything that can cause you to fall down or be injured in any type of way. Pelvic tilts can also help strengthen your abdominal muscles and your lower back. So make sure you do this exercise instead of doing sit-ups, because sit-ups have you lying on your back. So get on your hands and knees, relax the back of your neck, pull your abdomen in until your lower back flattens. Hold for 30 seconds, release, and then repeat this for 10 times. You can do this twice a day. So here's an example of doing pelvic tilts on all fours. Like I said, assume the all fours position, keeping your back straight. Don't let your lower back sag. Tighten your abdominal muscles so your pelvis tucks under and your lower back rounds. Hold for 5 counts, relax, repeat. And there's a variation to this where you hold your pelvic tilt while you swish your hips from side to side. So your head turns as if, your ear will touch your hips on that same side. And you can repeat this. Kegel exercises. I mentioned Kegel exercises. So it helps to strengthen the pelvic floor muscles used during childbirth. And like I said, it's the same muscles that are used to help stop the flow of urine. So squeeze your pelvic floor muscles for at least 5 seconds. I think I said 10 seconds, so 5 to 10 seconds. Relax, squeeze again. And you can work your way up to doing 50 to 100 Kegels a day. So do them every day to help strengthen those pelvic floor muscles. Nutrition and health in pregnancy. Healthy eating habits during pregnancy. So we want to aim for a healthy weight. So the average weight gain for a pregnant mother is 25 to 35 pounds. It's not healthy to be on a diet during pregnancy, because essentially you are eating for two, and baby will take what baby needs and then leave the rest for you. So you have to make sure you're eating for both of you. If you are overweight when you first get pregnant, it is common to lose a few pounds during that first trimester, but the average weight gain will still equal out to 25 to 35 pounds by the end of the third trimester. Each woman gains weight differently, so don't compare yourself to anyone else. Vitamins and supplements, so make sure, like I said, you take your vitamins. Iron makes the extra blood that you will need. The iron helps to build your blood up because, as you know, there is some blood loss during delivery, which is perfectly normal. But we need you to take your vitamins, take your iron, to make sure that you do have the blood volume that you need, so when you do lose that blood during delivery, it's not going to affect you. Calcium also helps to build and keep your bones strong, because baby needs calcium as well, and if you're not taking in the calcium, it's going to be pulled from your bones, because baby needs all these vitamins and supplements, so it's going to get it from somewhere, which is why it's so important that your diet has all these essential vitamins, minerals, and everything that baby needs. Folic acid is important because it helps to decrease the risk of certain birth defects. It's the most important in the first trimester when all these little baby parts are being formed. Fluids, 10 to 12 cups a day, and we're talking about water, not talking about coffee and sodas, because sodas have caffeine as well as coffee, but sodas also have a lot of sodium. So the more sodium you take in, the more water you need to flush that sodium out. So drinking extra water a day helps to limit swelling, and it also helps to prevent bladder infections. So let's talk about where the weight goes. Baby weighs, let's say, 7.5 pounds. Amniotic fluid is about 2 pounds, and the placenta itself weighs about 1.5 pounds. The uterus in the third trimester is going to weigh about 2 pounds. Your breast size increases, so that's about 2 pounds. Body fluids that you're holding on to is 4 pounds. Extra blood, because your extra blood volume is about 4 pounds. And then maternal stores of fat, protein, and other nutrients is about 7 pounds. So this totals about your 30 pounds of weight gain. Only 300 extra calories are needed during pregnancy. So if you take that adage about eating for two to the extreme, and you're eating way more than 300 extra calories a day, you are going to start gaining more weight, and then your doctor's going to tell you. And you don't want to have to put you on a special diet. So fruits about 2 to 4 servings a day, vegetables 3 to 5 servings, grains and cereals 6 to 11, dairy 2 to 3, protein 2 to 3, and fluids 8 cups or more. And like we said, around that 10 mark is the best. Things to limit: caffeine. And like I said, there's caffeine in a lot of things, especially in coffee. We know we love our coffee. Artificial sweeteners, also not a good choice at this point. It's better just to go ahead and have the sugar, unless you're a diabetic or you have gestational diabetes. You need to avoid sugar as well. And then organ meats, because there's things in organ meats that aren't good for when we're pregnant. Other things to avoid, of course, alcohol, tobacco, unpasteurized dairy foods and juices, and then raw or undercooked meat, poultry, fish, or eggs. Let's talk real quick about the effects of smoking on pregnancy. So smoking reduces oxygen and blood flow to your baby, as well as to yourself. Can cause miscarriages and can also cause stillbirths. And babies born to mothers who smoke are more likely to be born premature. They will also have a low birth weight and more likely to have asthma or other allergies. There's also a greater risk of SIDS with moms and parents who smoke. So it's also linked to childhood behavior problems and slower progress during early school years. And chemicals in cigarettes can be passed to the baby through breast milk. So if you do need to have, if you are a smoker, cutting back is the best thing for you to do, but also speak to your doctor about how you could quit smoking. Tests during pregnancy. Some common tests during pregnancy. Most of these tests will include blood work, and some of these tests will also be repeated when you come into the hospital to deliver your baby. But in your first trimester, you'll have most of these tests done in the blood work section. The CBC is the complete blood count. Anemia is most common in pregnancy and is easily treated with changing a diet or having iron supplements. So your CBC will show if you are anemic. It will also show if there's an infection present when there's an increase in the white blood cells. Your doctor, when you have this done, will discuss your results with you. Blood type and RH factor. If mother is negative and father is positive, mother will receive a RhoGAM shot at 28 weeks gestation. And then when the baby is born, the baby will be tested. And if baby is born positive, then mom will receive another RhoGAM shot after delivery. Now, RhoGAM can cause, the RH factor can cause a problem at delivery or with future pregnancies, only if mom does not receive the RhoGAM. There's a lot more I could say about RhoGAM and blood type and RH factor. But if you have any questions and you need clarification on this, please email me. I am happy to answer any questions you have. The AFP is alpha fetoprotein. It is the optional test, so you do not have to take this one if you don't want. But it tests for chromosomal abnormalities such as Down syndrome. The rubella titer. Rubella is not a common disease, but if contracted during the first 3 months, it can cause serious birth defects. So you will be tested for rubella in the first trimester, and then again when you come into the hospital. So if you are non-immune, which means your MMR, that's part of your MMR vaccinations. So if you're not immune, we will give you another MMR injection before you are discharged from the hospital after delivery. An RPR test is a test for syphilis. We test all moms. And also the HIV test. We test all moms. And hepatitis B. The glucose tolerance test is a test for gestational diabetes. So gestational diabetes only happens during pregnancy. Now, is there a risk if you are diagnosed with gestational diabetes? Is there an increased risk of developing type 2 diabetes later on in life? Yes, there is. But we test you for this because it's very important during pregnancy, because it can affect the outcome of your pregnancy. So you'll have the glucose tolerance test. It's about the same time, about 28 weeks, 27 weeks. And you'll be sent into the lab, have to drink this nasty cola stuff. They'll draw your blood beforehand, and then they'll draw your blood after, depending on how long this particular test takes. And that will determine how fast your body actually gets rid of that excessive sugar. So treating gestational diabetes is treated with changing diet, adding exercise, and then sometimes medications. Vaginal cultures, your doctor will do cultures for STDs, but especially for group B strep. That's going to be done about 36-37 weeks gestation. Group beta strep is very important. I believe I mentioned that again later on in this PowerPoint, but it's very important to know if mom is positive for group B strep. It is not a sexually transmitted disease. It is a normal body flora that some women have and some women don't. But they found 30 or more years ago that if a mom was positive with the beta strep, that it can be harmful for baby. So it can cause things like blindness, it can cause meningitis, it could even be so severe that they become septic and can lead to death. So if your doctor does your culture and it comes back positive, all it means is that you'll receive antibiotics while you are in labor. And as long as we get those antibiotics in, everything will be fine with baby. If by chance you're positive, you deliver too fast, and we're unable to get antibiotics in, baby will be tested and baby will go to the NICU for antibiotic treatment. So the antibiotics you receive as mom are to help treat the baby. Okay? And if you have any other questions, we can discuss that too. All right. So, tested vaginal around 35 weeks. It's more around 36, 37 weeks. Common bacteria, always harmless in moms, but like I said, can be dangerous for babies. There are no symptoms associated with beta strep at all. But like I said, it does affect the babies negatively. Treated with antibiotics during delivery. And then make sure you talk to your physician about what your results are. And occasionally, I will tell you this from working as a labor and delivery nurse, for 20 years. Sometimes your medical records don't make it to the unit. As long as you know that you were beta strep positive, make sure you tell your nurses, because that way we can get your antibiotics in a timely manner. Okay? Fetal kit counts. This is the best way to know that baby is doing well in utero, is by you doing your kick counts. All right? So, as it says, one way you can tell your baby's doing well is to record the baby's movements. Can be done after around 20 weeks or when you consistently feel fetal movement. Some people don't feel fetal movement till 21 weeks, so don't panic if that's the case. So you do the kick counts during your baby's active time of the day. So sit down or lie down. I find it more comfortable to lie down. And then make sure you have like a piece of paper or, your phone or something like that to kind of keep track of movements. So what we want you to feel is we want you to feel 10 movements. And this can take up to 2 hours because babies sleep a lot. So during their sleep cycle, they're not going to be moving as much. So it can take up to 2 hours. But if you feel 10 movements or 10 kicks or whatever, and it's only been 10 minutes, you're good. You're done. That is your fetal kick count. But if it takes longer than 2 hours, make sure you call your doctor, okay? So if it takes longer than 2 hours, drink a glass of juice, get up, move around, you can kind of wiggle your stomach a little bit. But if you're not feeling, those 10 movements, make sure you call your physician. Write down the time you feel the baby's 10th movement, okay? So call the doctor if your baby moves fewer than 10 times in 2 hours, if your baby moves less often than on the days before, or if you have not felt your baby move at all. Other reasons to call your doctor: bleeding from your nipples, your rectum, your bladder, or coughing up blood. So basically bleeding from anywhere is not good. So make sure you call your doctor and tell him or her about this. Vaginal bleeding. Now, if you've had a vag exam, within 24 hours of having some vaginal bleeding, it should only be a little bit of spotting, okay? Like a little bit of blood when you wipe, and it should go away. If you're having vaginal bleeding that's heavy, excuse me, or period-like, call your doctor, come into the hospital. That is the best thing for you to do. Excessive swelling of hands and face. We talked about that. Could be a sign of preeclampsia. Talk to your doctor. Blurry vision, seeing spots. The severe or continuous headache unrelieved by Tylenol. Those all could be signs of preeclampsia. Abdominal pains that don't go away with rest and water. If you're earlier than 37 weeks, could be preterm labor, so you need to come to the hospital or call your doctor. If you're term, then you could be getting ready for labor, okay? If you have chills or fever over 100, it's very important, let your doctor know. If you have persistent vomiting, you can dehydrate quickly with both fever and vomiting or diarrhea. So you need to be seen at the hospital in triage or in the doctor's office. Painful or burning urination could be a sign of a urinary tract infection, could be a sign of kidney infection. Absence or decreased fetal movement. So very important. If baby's not moving as much or not at all, you really need to see your physician right away. And if you have a sudden or slow escape of vaginal fluid, like if you think your water broke, even if it's just a constant trickle, make sure you're seen.